Quick disclaimer, information in this podcast is for general informational purposes only and is not intended to be treated as medical advice. Always consult with your healthcare team before making changes to your diet, lifestyle, supplementation, or medication.
Have you been told you have diabetes, but felt completely confused about how that diagnosis was made? Maybe your A1c looks okay, but your fasting sugar doesn't, or vice versa. In this episode, we're going to untangle the confusion and look at exactly how diabetes is diagnosed.
Welcome to Type 2 Diabetes Talk, the place where we chat about what really works to treat type 2 diabetes and prediabetes naturally with nutrition and lifestyle. If you're looking to optimize blood sugar and A1c, lose weight, reduce medications, and improve your overall health, this is the place to be. Now, here's your host, Type 2 Diabetes Nutrition Specialist, Dr. Jetta.
Hello there, wonderful people, and thanks for joining me. Today's episode is one I know many of you have questions about. How is diabetes actually diagnosed? This is a very fundamental episode inspired by the numerous questions we get about diagnosis and the confusion around those numbers. It's not always straightforward. I've heard from many of you who feel surprised or even blindsided by a diagnosis, especially when your numbers don't seem to match. So in this episode, we'll walk through the official medical guidelines from the American Diabetes Association, what tests are used, what the cutoffs are, and why two people can get very different results depending on which test is done. For those of you living outside the US, the same diagnostic criteria apply, but the diagnostic numbers might be slightly different. So what we're speaking about today will be applicable to you no matter where you're located. Plus, we'll go over two straightforward examples and cover two real questions from listeners, both of whom were left wondering how they went from normal to a diabetic diagnosis seemingly overnight. These will be great case studies to demonstrate the complexities and confusions that can sometimes happen with a diagnosis. Let's start by breaking down the diagnostic criteria, the tests and numbers that diagnose diabetes. There are 4 different tests that can be used: a hemoglobin A1c test, a fasting blood glucose test, an oral glucose tolerance test, or a random blood glucose test. A diagnosis can be made if any one of these tests reaches the threshold, and most often it's either confirmed on a second day or backed by another abnormal test done at the same time. Let's look at each one of these tests more closely. Before we go into that, the actual numbers, I want to re-emphasize that these numbers can be slightly different depending where you live. This is really frustrating, as ideally these should all be the same, but they aren't. So I'll make sure to include the different ranges for the US, Canada, Australia, and UK, just so you have those baseline numbers, because I know we have listeners from all over the world. The first test that can be used to diagnose diabetes is a hemoglobin A1c test, also known as HbA1c or A1c. This measures your average blood sugar over the past few months. Type 2 diabetes is diagnosed when A1c is 6.5% or higher, which is 48 millimoles per mole. That's the same all over the world. In the US, prediabetes is diagnosed when A1c is between 5.7% and 6.4%, which is 39 to 47 millimoles per mole, and below 5.7%, below 39, is considered normal. In most other places across the world, prediabetes is diagnosed when A1c levels are 6 to 6.4% or 42 to 46, and less than 6% or 42 is considered a normal A1c. So there is some variation there between the pre-diabetic and normal ranges from the US to other places in the world. The second type of test is a fasting blood glucose test, which is taken after at least 8 hours without food. This test measures whether your fasting blood glucose is normal or impaired. Type 2 diabetes is diagnosed when fasting glucose is 126 or higher. That's 7.0 or higher. That's the same criteria all over the world. In the US, prediabetes is diagnosed with fasting glucose of 100 to 125, and below 100 is normal. For most other places in the world, prediabetes is diagnosed with a fasting glucose of 6.1 to 6.9, while 6.0 or below is considered normal. But something to note here is that if your fasting glucose levels are between 5.6 to 6, this can still indicate prediabetes might be possible, especially if you have other risk factors. So the best course of action here is that if your fasting levels are considered normal, if you live outside the US that is, but they come back in that 5.6 to 6.0 range, take action now to avoid a prediabetes diagnosis and to protect your long-term health. Another test is the oral glucose tolerance test, or OGTT. This one involves drinking a sugary drink containing 75 grams of glucose and testing your blood sugar levels 2 hours later. This test measures whether your tolerance of carbohydrates is normal or impaired. Type 2 diabetes is diagnosed if the 2-hour result is 200 or higher, that's 11.1 or higher. Prediabetes is diagnosed with an OGTT result of 140 to 199 or 7.8 to 11.0. And below 140 or 7.8 is normal. So these numbers for our oral glucose tolerance test are the same all over the world. The other test that is sometimes used is a random blood glucose test. If you're showing symptoms of high blood sugar, things like excessive thirst, excessive urination, fatigue or blurry vision, a random blood sugar test might be conducted, and if the results come back at 200 or 11.1 or higher, this can confirm a type 2 diabetes diagnosis. A random blood glucose test is not used to diagnose prediabetes. If you're still confused by these diagnostic numbers, I understand it can be difficult to take all of that in when listening. So head to the show notes for episode 86 and we'll leave a table of the numbers to help clear that up, because it really can help to see them so you can review them in a reference.
It's time to leave all the noise and confusion behind and get proven, practical solutions that really work. Understand your diabetes and exactly what to eat to keep your blood sugar stable, lose weight, and reduce medications. All this and more is possible with Dr. Jetta's scientifically proven T2 diet program. Take charge of your diabetes health and join the program today. Visit type2diabetestalk.com/programs.
Now that we've gone over those tests and what the numbers that are used to diagnose are, next I want to share 2 straightforward examples of diabetes being diagnosed. Then I've got 2 specific case studies to share, and we'll delve deeper into answering the question about whether a test can be inaccurate as well. So case number 1, the annual checkup surprise. Emma is 59 and went in for her routine annual checkup. She wasn't experiencing any symptoms, but her doctor decided to run some standard blood work, including an HbA1c and fasting blood glucose test. Her fasting blood glucose came back at 132, 7.3, and her A1c was 6.7. Since 2 separate markers were above the diagnostic thresholds, Emma was diagnosed with type 2 diabetes that day, even though she felt fine. This is a classic example of how type 2 diabetes is often diagnosed through routine testing, sometimes before any symptoms even appear. Often people don't even know they have diabetes, since diabetes often displays 0 symptoms. And it's very common for people to be diagnosed when they take a visit to their doctor for an entirely different reason. Case number 2, symptoms lead to testing. Now let's take John. He's 49 and had been feeling unusually thirsty, getting up several times at night to urinate and feeling more tired than usual. He made an appointment with his doctor to talk about it. His doctor ran a random blood glucose test while he was in the office, and it came back at 228, 12.6. Because he had clear symptoms and a glucose level over 200, over 11.1, that alone was enough for a diagnosis of type 2 diabetes. In case number 1, Emma had no symptoms. She's what's called asymptomatic, but she had 2 different types of tests that came back above normal and in the type 2 diabetes range. So she was confirmed as diagnosed type 2 diabetes on the spot. In case number 2, John was symptomatic, displaying symptoms of diabetes, and his random glucose test came back above normal and in the type 2 diabetes range. So he was confirmed as diagnosed type 2 diabetes on the spot. Let me just explain these 2 criteria that can be used by a doctor to determine how to proceed with your diagnosis: symptomatic and asymptomatic. If you're symptomatic, it means you're experiencing signs that something might be wrong with your blood sugar. These could include excessive thirst, frequent urination, blurred vision, unexplained weight loss, or constant tiredness and fatigue. If those symptoms are present and your blood sugar is high, like in John's case with the random test, then that alone can be enough for a diagnosis. Or if you are symptomatic and your A1c, OGTT, or fasting glucose came back abnormal, you could also be diagnosed with type 2 diabetes off one abnormal test alone. But if you're asymptomatic, meaning you feel fine and don't have any of those obvious signs, then the guidelines recommend a more cautious approach. In those cases, at least 2 abnormal test results on separate occasions are typically required to confirm prediabetes or type 2 diabetes. Or, as in Emma's case, they can be the 2 different types of tests that come back above the normal range, which can confirm a diagnosis. So keep these things in mind as we discuss our next 2 case studies. TARYN sent in a message saying, "I'm interested to know more about the role of HbA1c and oral glucose tolerance test as I've been diagnosed with type 2 diabetes. I love my doctor, she's amazing, but I left her office the first day with a script for metformin and the plan was to return for a longer consultation. Before the next appointment, I had started my own research, and one of the things I found was your podcast, which has been extremely informative. My HbA1c in February was 6.0, which would indicate prediabetes, but my oral glucose tolerance test indicates I have type 2 diabetes. I'm frustrated as it's like I've skipped prediabetes and gone straight to type 2, a label that will stick forever, which means I have no chance of turning around the diagnosis. My doctor says we've caught it early. In my appointment, I told her I hadn't started the metformin as my HbA1c at 6 wasn't too bad, so I'd like to try and turn it around with diet and exercise first. I guess I'm just interested in your views on what role the HbA1c and OGTT play in diagnosis." So thanks for sending that question in, TARYN. So TARYN was given a diagnosis of type 2 diabetes, and she was feeling frustrated about it because of the discrepancies in the results. On her first test, her A1c test was 6.0 in the prediabetes range, but her oral glucose tolerance test was in the type 2 diabetes range. Both of these tests indicate an issue with glucose metabolism because both are outside the normal range. One result is prediabetic, one is diabetic. So how does the doctor choose? The A1c test measures your average blood sugar over about 3 months, but it can sometimes miss sharp spikes after meals, especially in the earlier stages of glucose dysregulation. A1c has a lower sensitivity than testing your 2-hour postprandial glucose, whereas the OGTT, where you drink a sugary solution and measure blood sugar 2 hours later, is really good at detecting those post-meal highs, which can be a first sign that your body's struggling to manage glucose. So your doctor is right, TARYN, by saying that you have caught it early enough that your A1c levels aren't too high, but your body is showing you it's struggling with carbohydrate metabolism. And it's likely those post-meal spikes that are raising your blood sugar in the first place. According to the guidelines, if a person has 2 tests that indicate diabetes, a diagnosis is confirmed. As for which diagnosis, well, that could depend. If you are symptomatic, had those other symptoms like excessive thirst, frequent urination, blurred vision, unexplained weight loss, or constant fatigue, then the doctor could confirm the type 2 diabetes diagnosis off one single oral glucose tolerance test. But in TARYN's case, even if she didn't have these symptoms, because of her high A1c in the pre-diabetes range, the single oral glucose tolerance test does in fact confirm this as a type 2 diabetes diagnosis, since essentially the A1c test is indicating a clear symptom of diabetes, high blood glucose. If TARYN didn't have the elevated A1c, if it was only the oral glucose test that came back abnormal, then the doctor would have ordered another oral glucose tolerance test on another day to confirm the diagnosis. Of course, TARYN, if your doctor does subsequent tests within a short time frame and your oral test is not in the type 2 diabetes range, then you'd have to have a discussion about the diagnosis. But for now, while it may seem frustrating, your doctor has diagnosed you accurately based on the guidelines. It has been caught early, and you have one very good indicator to work on, 2-hour post-meal glucose, and that is very easy to lower via diet and exercise, often without medication. Before we move on to another case study, let's hear a testimonial from one of our members.
Carrie said, I joined DMP as a member after my diabetes diagnosis. After joining, my A1c went from 8.4 to 6.1 in 3 months. I lost 35 pounds and my cholesterol levels dropped. I trusted DMP experts without hesitation because DMP explained everything in a way I understood and my labs were so good.
Our next case study comes from Amanda. She said, I am someone who suffers from bad health anxiety, and whenever I am coming up to blood work, I get myself worked up. My last blood test recently had my fasting blood glucose at 7, that's 126, but my HbA1c at 5.6. My doctor still said I now have type 2 diabetes, and I'm not sure what to believe, as I know stress can affect fasting blood glucose levels. But she just brushed me off when I said my HbA1c is more indicative of my actual blood sugar levels overall. Very confusing. Firstly, thank you for being so open, Amanda. I want to say clearly your feelings are completely valid. When you're already anxious and you receive what feels like a conflicting message from your doctor, it can be incredibly unsettling. Let's unpack what could be happening here. So in Amanda's case, we see another instance where A1c levels are normal, but this time it's a fasting blood glucose test that is high at 7.0, which is 126. And this is considered within the type 2 diabetes diagnostic range. The fasting blood glucose test is just a snapshot, a single moment in time. And yes, it can be influenced by stress. When you're anxious, your body releases hormones like cortisol and adrenaline, which naturally raise your blood sugar. So it's entirely possible that your fasting level on the day of your blood test was artificially elevated by that stress. Now, your A1c of 5.6 suggests your average blood sugar over the past few months is still in the normal range. According to guidelines, that wouldn't meet the threshold for type 2 diabetes. In fact, it's below even the pre-diabetes range. It is perfectly normal. So in cases like this where there's a clear mismatch between A1c and fasting glucose, where there is a clear discrepancy in the test results, and particularly where there's a plausible reason for the elevated fasting result, it's usually good clinical practice to repeat the test or look at other markers before making a firm diagnosis. But something to consider is that the fasting level is quite elevated. It's not just marginally elevated. And another thing is your doctor has your full medical history, so it may be the case that they consider you a symptomatic person, a person who has symptoms of high blood sugar, such as excessive thirst, frequent urination, blurred vision, unexplained weight loss, or constant fatigue. If that were the case, then they can confirm a type 2 diabetes diagnosis of one single elevated fasting blood glucose or random blood glucose test. Or there may have been another reason why they reached this conclusion so readily. Amanda would certainly need to discuss those specifics with her doctor. Theoretically speaking, if you have one or multiple symptoms of diabetes, it could suggest rapidly evolving diabetes, even though A1c levels are normal. The thing is, a fasting blood glucose levels can be one of the first things to rise, even before we see a noticeable change in A1c levels. But according to the guidelines, unless there are clear clinical symptoms of high blood sugar or high blood sugar crisis, for example, being submitted to the emergency room, then 2 abnormal screening results are required. Results can either be tested at the same time, for example, a high A1c and fasting blood glucose, or at 2 different time points. In Amanda's case, if there was no valid reason for the diagnosis, then a separate fasting blood glucose test should be done on a separate day within a short time frame. So again, something to note is that fasting blood glucose is often one of the very first blood glucose measures to rise. If you have caught this higher early, then it's providing you with insight into how well your body is managing blood sugar overnight, especially liver glucose output, and indicating your baseline insulin sensitivity and metabolic function. So if it is the only measure that is high, it's giving you an early sign that some changes are occurring in terms of your insulin sensitivity and insulin resistance and your metabolism. And that's powerful because you can work on these things. But of course, if you wanted to discuss the specific diagnosis with your doctor, one proactive strategy you could take here is to monitor your own blood sugar at home, especially your fasting levels and post-meal responses over a couple of weeks. And you can then take an assessment of yourself, looking at the patterns, and note these down on paper so you can give those to your doctor, and you and your doctor can have a discussion and have a more complete picture before settling on a diagnosis. As you probably become aware from our different case studies, the diagnostic tests reflect different aspects of glucose metabolism. A1c, based on an average measure of glucose on the blood over a 3-month period. Impaired fasting glucose, based on the fasting blood glucose test. Impaired glucose tolerance, based on the 2-hour postprandial glucose test. And that 2-hour postprandial glucose test is based on how your body manages a glucose load. Can tests be inaccurate? Absolutely yes, they can. While it's not common, it is a possibility. HbA1c tests can be false low if a person has substantial blood loss, renal failure, in pregnancy, in relation to vitamin E levels, in the presence of certain types of anemia, among other things. HbA1c tests can be false high if people with B12, iron or folate deficiency, abnormal spleen function, blood transfusion, or with random hemoglobin variants. Fasting blood glucose can be thrown off by acute stress, a bad night's sleep, illness, menstruation in women, or even what you ate the night before. An oral glucose tolerance test result can vary depending on how physically active or carb depleted you were in the days leading up to the test. There can be discrepancies in results, and it will come down to the other information your doctor has. That's why the guidelines recommend confirmation, either repeating the same test or using a second test, especially in people who are asymptomatic, people with no symptoms at all. Having a second test, requesting one, is not just a safeguard, it's a reminder that these tests give us information, but they're not absolute truth in isolation. So if something feels a bit off, trust your gut. Ask questions and don't be afraid to request a second look. Your health deserves clarity, not confusion. And remember, a diagnosis is not a verdict. It's a guidepost. No matter what label you feel you may have been given, your health is something you can influence. And you're already doing that by asking questions, learning more, and staying engaged in your care. We know from over a decade of experience that no matter how long the diagnosis, people can turn this around. So don't let that label define you. What you do from here matters more than the name in your file. Remember, we provide an amazing service to help people achieve normal A1c, lose weight and get off the meds, and we've got incredible real support to help you overcome confusions and gain clarity. And that includes helping you work out these test results. So be sure to head down to our website to learn more about how we can support you. So thanks for listening, and I hope it's provided some clarity and confirmation about how diabetes is diagnosed. And if you know it will help someone else, please share. That's all from me today. Dr. Jetta, over and out.
Thanks for tuning in to Type 2 Diabetes Talk. Please subscribe to the show on your favorite podcast platform. And for episode replays, episode notes, and more, visit type2diabetestalk.com. New episodes are available Tuesdays, 10 a.m. US Eastern Time, or your time zone equivalent. Thanks again. We're truly grateful to be a part of your life and help make a real difference.